Congratulations on the new addition to your family. We understand that this is an exciting time. We hope that you'll allow us to take just a few minutes to talk about newborn screening.
Since 1965, as part of routine medical care, every baby born in New York State has routine screening. This newborn screening allows us to ensure that babies will be as healthy as possible. To do newborn screening, we take a very small amount of blood from a heel stick. And with that blood, we can test for over 40 different conditions, which, if identified early, can help keep your baby healthy. Some of the babies with these problems can look absolutely normal at birth. So it's very important to get newborn screening quickly after birth so that we can find out who might have a problem and intervene quickly so that they're healthy in the future.
New York has one of the largest newborn screening programs in the United States. And we are always working to expand and improve the newborn screening tests that are offered. One way we can do this is by offering an additional newborn screen, which tests for conditions that are not currently on the routine newborn screening panel. Over the next 4 years at Mount Sinai, Elmhurst, Maimonides, and NYU Langone Medical Center, you will have the opportunity to take part of this additional newborn screening test.
People with the most common type of Gaucher disease can have an enlarged spleen, liver, low blood counts, and bone disease. Types 2 and 3 Gaucher disease are much more rare and also involve the brain. There are safe and effective FDA-approved treatments for Gaucher disease, which can reduce the size of the liver and spleen and improve blood counts.
Pompe disease affects the muscles and the heart. Infants affected with the severe form of Pompe disease usually die in the first year of life. However, there is a safe and effective FDA-approved treatment which is most effective if started in the first month of life.
Type B Niemann-Pick disease affects the liver, spleen, and lungs. Babies with type A Niemann-Pick disease also have brain involvement. We are currently testing a new treatment for patients with type B Niemann-Pick disease to see if it is safe and effective. At this time, there is no effective treatment for babies with type A Niemann-Pick disease.
Fabry disease is a rare disorder that causes kidney failure, cardiac disease, and stroke. It is inherited in an X-linked manner, which means that males are more affected than females. There's a safe and effective FDA-approved treatment which works best if started in childhood or as soon as possible.
We know that all of this information may be overwhelming, but for these rare diseases, early intervention is critical for seeing the best outcomes. This additional screening will quickly determine if your baby has one of these disorders. The earlier the diagnosis, the earlier the treatment.
We were lucky to end up at Mount Sinai, where we were diagnosed and received successful ERT treatment that reversed the symptoms. As a result, my children lead normal and healthy lives. So yes, to additional newborn screening. I would do it in a heartbeat. With early detection, symptoms can be prevented, and families will not have unnecessary stress regarding the health of their children.
During the weekday, there will be a research coordinator, like myself, available to discuss with you and your family the value of participating in these additional screenings. By now you should have seen or received a brochure that looks like this, either from your doctor's office or in your welcome packet. As you can see, there is a line for you to write your name, your baby's name, the baby's date of birth, and your room number, informing us that you would like your baby screened for these additional diseases. Once you have filled out this information, you will take this brochure and place it into the locked drop box that is near the birth certificate box by the nurse's station.
If you have any questions or would like to know more, please don't hesitate to ask. On behalf of our newborn screening team, thank you for taking the time to watch and listen. Again, congratulations.